here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow, where we bring you the conversations that matter most for the health and well-being of our communities. I'm Will Rucker.
And I'm Ciara Owens.
And we are so grateful to have you with us for a powerful and a timely show. As we step into September, I want to begin with an important reminder. This month marks Suicide Prevention Awareness Month. This isn't just an awareness campaign. This is personal. Suicide touches families, workplaces, schools, and communities in every corner of the globe, and especially right here in Las Vegas. But we know that together, small actions can save lives because hope is real, help is available, and healing is possible. So remember, you matter, your life matters, and if you or someone you know is struggling, please call or text 988, the Suicide Crisis Lifeline. It's free, it's confidential, and it's there for you 24/7. So let's break the stigma and build spaces where mental health is a shared priority, not just a private burden. So, Ciara.
Yes.
How are you?
You know, the truth and what sounds good are two different things. I'm doing well overall. I'm very blessed, and I'm trying to keep that center everything else, but I'm doing okay. How about you?
You know, I like how you put that, right? But I am grateful. That's how I am.
Yes,
Yeah.
that's real. One thing I want to add to your message is, y'all make sure you check on your strong friends. I think sometimes people add a stigma to the face of suicide awareness overall, and so check on everybody.
That's right. Yeah. Because it's amazing. You wouldn't expect someone like a Robin Williams, who brings the world so much joy, to carry such deep pain, right?
Yes, the Twitches. I was at a conference last week and they were playing a clip of the Ellen show.
Yeah.
And he was over there just like, yo, you would have no idea. So y'all never know what's happening behind closed doors, behind those smiles, behind those eyes. So lean in, y'all, and be okay asking the explicit questions.
That's right. And that brings us to today's show.
Yes.
Because mental health and brain health are deeply connected. So tell everyone you know, text your group chat, send a carrier pigeon if you got one, post on Instagram or Facebook. Let everybody know A Healthier Tomorrow is on the air. We are Southern Nevada's #1 community health show, and we are right here on Power 88, the People Station.
Yes. So one thing that we absolutely love is collaboration and partnership. And today, y'all, instead of having 2 segments of guests, we have a full segment of 3 powerhouses in our community. Fellas, y'all mind introducing yourselves to our listeners?
Thank you so much. I am so thrilled to be here. My name is Phil Kalsman. I am the Regional Director of the Alzheimer's Association for Southern Nevada.
Thank you for having me. My name is Xavier Foster, and I am the Health Equity Coordinator at the Southern Nevada Health District.
And I'm Ben Challoner. I'm the Director of Public Policy for Nevada with the Alzheimer's Association.
Welcome, y'all. We are so grateful to have you. So as we dive in, what is the Brain Health Initiative?
You know, that's a great question. We, as well, like to overcome some stigmas in associated with Alzheimer's. And one of the biggest ones is that it's a normal part of aging. Really just trying to get the message out there that Alzheimer's is not a normal part of aging, that it is, in fact, a brain disease. And that it's hard to talk about. Let's be honest. It's not something that people like to talk about. We have a lot of folks who are very independent, and it affects them very hard. But it also affects their family. And so talking about brain health, just getting this out in the conversation is our first big step. We all think about our heart health and our mental health. Brain health is something that we know we can have an effect on. So it is and has to start with having that conversation.
Yeah, and Philip, I like that you point that out, because I'll be very transparent. I didn't think that brain health was something I could control. I know if I exercise,
right?
You know, I can work out my heart, or, you know, I can stretch and have muscle activity in that. But talk a little bit more about the brain aspect.
So, you know, we're finding science is really beginning to hone in on what we call modifiable risk factors. We know what's healthy for your heart, for example. We all grew up knowing that, hey, get out there and do your jump roping or whatever and get your heart in better shape. We know the same is true for your brain. So watching what you eat, getting active, challenging your brain and socializing. That's the big thing, socializing. And frankly, we're really starting to work more with our youth because we know their 65-year-old self is going to really appreciate them doing it this earlier in, much earlier in life. So brain health is something that we can have an effect on if we start early, and it's never too late, even for people who are later in life.
And I just want to add, we're using the words, we will be using the words Alzheimer's and dementia pretty interchangeably. Some folks may think it's a separate thing. Dementia is, a cognitive impairment. Alzheimer's is a type of dementia. There's some that folks may recognize, Lewy bodies, vascular dementia. When we talk about Alzheimer's and dementia, right now we're using it interchangeably within the brain health conversation, but we want to make sure that folks, if they know someone that has a type of dementia or versus Alzheimer's, that's what we're talking about here. We're not just talking about only Alzheimer's or only dementia, because when folks start talking, having conversations, they may not realize, oh, that actually pertains to me, even though they're going through it as well. And especially within our communities. I'm Latino. Within the Latino community, it's 1.5 times more likely, more prevalence to get Alzheimer's dementia than within the white community. Within the black community, it's twice as likely. And so these conversations, especially here, it's extremely important that we have these brain health conversations now, because, like Phil said, these modifiable risk factors, meaning that, if you make some changes here and there, your risk of Alzheimer's and dementia significantly decrease. So that's why we want to make sure we're talking to folks.
You must have been in my head, because that was going to be one of my questions before it was over. Like, what's the difference between the two? So thank you, Ben.
Now, Xavier, tell us a little bit about the partnership between the Southern Nevada Health District and the Alzheimer's Association.
Yeah, this opportunity just provide us the opportunity to look at this from the public health approach. So just put in our resources, our relationships into work. To support all the activities that not only the Alzheimer's Association is doing, but all the many other organizations that are providing services around this topic.
It's expanding our circle of influence really through the Southern Nevada Health District as well. Xavier already works with so many community partners that we may have not known about or worked with in the past, and so it's just really expanding that circle of influence.
Yeah, I love that. And I love that you're doing this collaboratively because, Philip, as you mentioned, relationships actually are a protective factor for health. So having those connections, shout out to Lily, who was here earlier.
Yes.
Go to the Janet Jackson concert, ma'am. It's good for your brain health.
Yes, it is.
It is. It really is. And we forget about those little things, but it makes a big difference. We got to get out and live, right?
Yes,
Yes. So when you spoke about two things, like one, teaching our like young people early about brain health and like really learning, like leaning in and doing brain challenging things, what does that look like? Like crossword puzzles and word searches, or like what does that go to?
Yeah, absolutely. Crossword puzzles, doing things differently rather than, let's be honest, rather than sitting there with all the screen time that kids normally have right now, right? But in addition to that, some of the basics, like if you're going to get out and ride your bike, or these days an e-bike, wear your helmet. Please wear your helmet. Those are just some of the basic things you can do to help protect your brain. And again, it helps mitigate the chances of you developing dementia in the future. The more we can do now, earlier in life, again, your 65-year-old self is going to love you for it.
Yeah, absolutely. So I hear that there are 10 healthy habits for the brain.
Yes.
Let's talk about them.
So, and Ben, if you want to jump in here as well, please do. We've looked at a study just recently released that really quantifies how these can help slow down or reduce your chances of getting Alzheimer's or dementia. But we kind of talked a little bit about challenging your mind, protecting your head, and one of the big things that people just don't think about, but keep making sure your blood pressure is under control and your diabetes is under control. Those are two huge things.
Especially within our communities, within the Black and Latino communities, those are diseases that run really rampant within our communities. And so With my father-in-law, trying to get him to control his diabetes, trying to make sure that he eats healthy. That's another one, making sure you're eating right and maintaining a healthy weight. And another one that's also very important is sleeping well.
You just picked one of my favorites. I love a nap.
We have a lot of stress within our communities, and throughout, Vegas itself, we have a lot of, it's not the city that never sleeps. I think that's New York, but it's the 24-hour. Shift work. We have folks working on the Strip. We have folk working all over the place. But making sure you get your sleep in at least those 8 hours, and making sure it's high quality sleep. So if you have sleep apnea or undiagnosed sleep apnea, you get that addressed as well, because you may be sleeping, but if you're not getting quality sleep, that's also affecting your brain.
I really appreciate you saying that. And with the sleep apnea, that's something, it's we don't talk about, but so many people live with that. And it is something that we can address. And hearing that it impacts your brain health makes that even more urgent. It's not just so that your partner next to you can sleep, right?
Yes.
It's for your own brain health.
And I think too, Will, the environment. We have a lot of multi-generational homes here, and making sure that when it comes time to quiet down in the evenings for bedtime, that the whole house is kind of mirroring that environment, if you will, and everybody's kind of settling down and making it a place where people can get a good night's sleep.
Because we don't really think of sleep as a health activity, but it absolutely is. That's
when your brain does its rinse and clean cycle, right? It's clean and rinse, if you will. That's when your brain goes through the healthy rejuvenation. Yeah. It's during your sleep,
absolutely. And that's connected to learning, because I see stay in school is one of the 10 healthy habits.
Absolutely. And it's not just staying in school, but it's, doing something to expand your mind. So, I know at CSN, wherever they have those extra classes that you could take, learn a new skill, pick up baking. It's learning anything new, picking up a new language. It's just a way to make sure that your mind is continuing to learn. And then one of the last ones that we have here is get moving. So that just means that at minimum going out for a walk. I'm not talking about going on running a marathon or doing these triathlons. That's
no triathlons today.
I am a runner, I will say that. But not everyone has to do those insane activities. It's just easy enough as, getting on one of those bikes, a push scooter rather than the electric scooter, but making sure, you're keeping moving, you're staying active, you're making sure the blood is flowing throughout your entire body. And so, these are 10 healthy habits that you can do, and it's not too early to start and it's not too late to start, to make sure that you're able to make a difference.
I want to dive a little deeper into some of these in just a moment, but just a reminder, the Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. September is National Childhood Obesity Awareness Month. Raising healthy kids is a family affair, so get the whole family involved. The best thing you can do to help your child achieve the healthy body that is right for them is to create and practice healthy habits every day. For more information, visit www.gethealthyclarkcounty.org. And with that in mind, we touched on it lightly, but eating right. That's so important. Would you share a little bit more?
Yeah, so Phil recently mentioned the U.S. Pointer study. That's a study that came out at the end of July, and it's one that the association helped sponsor. And it looked at some of these modifiable risk factors, and within that included eating healthy, eating well, and so making sure that you're getting your full range of fruits and vegetables, as well as your proteins and your fats. Making sure you're eating the rainbow. I know that's a tagline for some candy, but it's true. When you're looking at your plate, making sure you have all different colors on there. That way you're getting as much.
Wait. I was going to say, can we just stop at the candy part for a minute?
I love that. And you're right, Skittles. That's the brand. But and we're so fortunate here in Las Vegas, because we've got the Gilcrease Orchard, we've got the Oboto Collective right here on the west side, and so many other places where people can go and get foods they wouldn't ordinarily see. The farmers markets that the health district sponsors, and just try something new. I had purple cauliflower the other day, and and you're wearing purple, of course, right?
It's our color.
But that's the eating the rainbow is not just good for your health; it's good for your palate because you try different things.
Yes, and that doesn't mean add the bacon grease and everything to the rainbow too for y'all. Like eat the rainbow with some steam, light olive oil. Let's cook it up right, not cook the nutrients up out of it.
Yeah. But you know what? That's such a good point because at the end of the day, our ultimate right of determination is what we put in our mouth.
Yes.
Right? The fuel that we put in our bodies. And it does make such a huge impact. And it's hard. It's hard, especially when other things are so convenient. But really taking the initiative and the ownership of what you're preparing and cooking and being able to make that a priority in your life is huge.
Yes. Like you say, we don't thank our 65 cells later.
Yep.
A question for you. You mentioned about the U.S. Pointer Brain Health recipe. And one thing on here that I found very interesting is the cognitive exercise, specifically the computer-based portion of it. What does that look like, especially when we talk about wanting to limit screen time and like getting us out, moving, socializing, for that to be such a key piece? Tell me a little bit more, if you don't mind.
So that I haven't had a chance to delve into it too much, but I know it's making sure that you're keeping your brain active. And so I know some of the things that they had available to them on the US Pointer may not be available to everyone, but it's certain things that you're able to do, on your phone. So, if you do the daily Wordle, the connections, right. I know that the New York Times Connections right now is very popular in addition to the Wordle, but it's the Sudoku, the crossword puzzles, and making sure you're able to do that. But again, it also ties into sleeping well. So once it's time to go to bed, making sure you're staying off those screens, because that blue light from those screens affect your sleep rhythm. And so circadian rhythm, I forget exactly what it is, but it's all interconnected. When we mention one thing, it connects with something else within the healthy habits. And that's what the US Pointer study looked at, is making sure we're looking at the full spectrum of it.
I love the interconnectedness. Sometimes we think that health is like, I'm just going to do this and it's not going to influence other things, but it connects to so much.
Absolutely does. And Xavier, a lot of your work is in social determinants of health. And so all of this is connected. I'd love to hear a little bit more from you, particularly around like the prevalence here in Las Vegas and some of the things that we can do to ensure our community is aware and doing what we can to modify those risk factors.
Yes, the 6 factors or risk factors that we see or we have more prevalence come around maintaining your blood pressure, maintaining a healthy weight, managing your diabetes. A famous issue that we deal with here is smoking.
Yes.
So make sure that
let's pause there. Let's talk about that.
Let's talk about it.
Because we haven't had the smoke-free team on in a while.
Yes.
But just want to put a plug out there. Smoke still is unhealthy.
Yes.
Still is.
That has not changed.
Doesn't matter what form it's in, y'all.
Yeah. Just checked. It's still not good.
So we have done a lot of progress here in the city. We're restricting those areas where smoke is. Where you can smoke or not smoke, and we are continuing at the health district to push on policies to increase those areas where you are not able to smoke. But yeah, so just doing simple stuff as if you cannot quit, just reduce the amount and hopefully just work towards the goal of quitting smoking. And then we also have keeping active. I mean, we have so many spaces that we can go in and be active. I know during the summer it may be hard, but go take a hike at Red Rock, go to the lake and swim and stuff, and those activities. And of course, sleeping well. Those are the 6 risk factors that we kind of see a prevalence here. And of course, we see those in those areas where we have we have groups such as African American and Latinos, where we see the highest prevalence of those risks.
Yeah, well, I'm just really noticing the risk factors are directly tied to the healthy habits.
Yep.
Yeah. So, I mean, if we start these healthy habits, it's almost, you don't even have to really think about the other stuff, because if you're doing the healthy habits, you're automatically controlling for diabetes and weight and getting active and doing those things that you just mentioned.
Yes, and that's why the Brain Health Initiative is really focused on concentrating on those social determinants of health, because they do address all the habits that we are talking about today.
And I think it goes back to what we kind of started the show with, is just kind of the stigma or the assumptions that are made sometimes about brain health. Let's be honest, normal brain aging it happens to all of us. The big difference is that if we lose our keys or whatever, forget them, we can retrace our steps. People who are becoming cognitively impaired with dementia or Alzheimer's, they lose that ability. And so what we're trying to do is just raise the awareness that your overall health truly affects your brain, and we can do something about it.
And let me know if I'm wrong about this. There's really no age discrimination to this. We may see it older, but
right.
It can be.
And we think that. We think
right.
that it's an older person's disease. Oh, it's come time for Thanksgiving, put grandma in the corner because
right.
God knows what's going to come out of her mouth. Well, the reality is, the more we look, the more we are realizing and finding that younger people have had the disease long before the symptoms show up. It can take 10 years before the symptoms show up. And by that time, unfortunately, that proverbial train has left the station and intervention becomes more limited. So we're really focusing on self-advocating. If Dad just doesn't seem right, he couldn't add up the tip last night when we went out for dinner. Hey, something's wrong. Let's go talk to his primary care and push for some testing.
And the majority of folks that we have data on that have Alzheimer's dementia are 65 and older, but we also have folks who are younger onset, which is folks below the age of 65, below the age of 60. We've had folks in their 40s, 30s, some very rare cases even in their 20s. Mm-hmm. And so brain health is not just for over 65. It's, Phil earlier talked about multi-generational. A lot of us have multi-generational homes, I'm sandwich generation myself. I have my baby at home as well as my father-in-law most of the time. And so, there's things that we can do. We all go on a walk together. We all make sure that, when we go grocery shopping, we're shopping for foods that are healthy for us. We're making sure that, if we put on TV, it's not, the brain rot TV. It's actually something that, semi-educational, so we can make sure that we're learning something new. And so we are modeling those behaviors. I'm modeling those behaviors for my father-in-law as well as for my baby, for eventually they'll be able to see, continue on with these 10 healthy habits as well.
Now, Phil, Ben, keep me honest here. I'm looking at the documents, I'm looking at the talking points, and one thing I don't see is music.
Oh,
good one. So the science is working on it. We know that music has really deeply rooted spots in our brain that just lights people up who are cognitively impaired. You can just see it in their faces. And music therapy is real. What we're trying to do is clinically prove where that is happening so that we can cognitively modify or improve behavior. And we're not there yet. We're working on it. There are some researchers down at the University of Arizona that are really diving into this. But music, we know it helps. We know it helps people. It just brings them back to a time and lights them up. You can see it in their faces. And we know that it is incredibly important in so many families. So we're all for any type of music that you can incorporate and bring into someone's life.
Love that, because I was a professional athlete in high school. I was part of the marching band.
See, me too.
Look at you.
What'd you play?
I played saxophone.
Trombone.
All right. Baritone.
I was a flag girl. I was a girl.
So we all got
but
that physical exercise, right? That's physical, that's cognitive, that's the relationship piece. And it really does make a huge difference for the entire lifespan.
Absolutely. Absolutely.
Good. Well, one more question before we let you guys go. How are we getting this message out to the community?
Well, this is where the Southern Nevada Health District comes in this partnership and collaboration. As part of this program and initiative, we held 2 community meetings where we had several of our community partners come and just learn about this data, learn about the information, talk about the resources and the gaps in our community, and come up with what we are calling an action plan. So that action plan is going to include between 20 activities that different organizations are going to carry out in the community to inform the city, inform providers, inform youth serving organizations in what brain health is, the steps that they can take, and just take a dent into this risk and modifiable behaviors. So out of this, we are coming out with an action plan that we will be presenting to the community. It's going to be hosted in the SNHD website, so it will be available there, and we will be making some type of announcement so the community know when it's out and it's ready, and they can know who they can contact to receive services or information and participate in our outreach events.
And I would also say, Xavier's absolutely right. We've got a lot of great information coming out. People can also just go on to alz.org and find information. There's so much available to folks.
So many different ways. It's, we're Alzheimer's Association is the largest Alzheimer's and dementia organization in the world. We lead in research. We lead in fundraising for it. But it's also about meeting folks where they're at. So that's why this partnership with the Center Valley Health District is extremely important, because they have those relationships on the ground, and it's making sure that our information, our data is getting to in front of the people that need to hear it the most. That's everyday folks.
Well, friends, thank you so much for spending your morning with us and sharing this great information with our audience. We really, really appreciate it. Now, Ciara, we've got about 60 seconds left. What's going on in the community?
There's so many things. Let's start with the neighborhood meeting for the Historic Westside Complete Streets Project. It's happening today, y'all, from 5 to 6:30 p.m. The presentation will start at 5:30 at Doolittle Community Center, 1950 North J Street. This is your opportunity to have an informational meeting regarding the upcoming Historic Westside Complete Street Public Work Project that is going to be happening from Washington Avenue to Martin Luther King Boulevard. Also, as Will mentioned earlier today, the Childhood Obesity Awareness Month is in September. So really think about small steps will lead to big changes for our kids, and healthy habits start at home. Adding one veggie to every meal, 60 minutes of activity a day, and let's decrease that screen time, y'all. It's also National Preparedness Month. Emergencies don't wait, so be ready. Have charged devices, stocked water, pack a to-go bag. Start with one action today to make sure that you are ready for any emergencies that may happen. We got time for one more, Will.
One more.
All right. Go ahead and check out the Clark County School District Family Support Center for their September calendar that includes so many amazing things, from legal services, newcomer support, wellness and support, immunizations, different things of that nature. Dive in, and the parent engagement workshops. Y'all, kids need to be in school, so every day matters. They need to be in school to be able to learn and have their health count.
This has been A Healthier Tomorrow. I'm Will Rucker.
And I'm Ciara Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So stay healthy, y'all. We'll see you next time.
Happy Wednesday.